50% of a medical doctor job is to communicate in a very comprehensive language with his patients. From the 1st of January this year, the new reform of pricing of medicine have into force. This is very important for politicians, not to be far away from the people.
Hello, everyone. Welcome back to OncoDaily. Today, it's a great honor and pleasure for me to welcome a distinguished guest, Dr. Hosams Abu Meri, the Minister of Health of Latvia.
Hello.
Thank you very much for being with us, and thanks for finding a time in your busy schedule.
Thank you for inviting.
With pleasure. Without further ado, I'd like to ask, why did you decide to become a doctor?
Oh, it's many years ago. Actually, in my childhood, I was maybe 3 years old. I have born in a family of doctors, a lot of doctors. So my 2 uncles, they are doctors, and then my friends and my cousins, and so if we meet in summer in a dinner or lunch, so at least 3-4 doctors on the table. So it's something like genetic, let's say.
So an extended family, and you had no chance not to become a doctor.
Exactly.
I'd like to go early on your days at the medical school, how it looked like, what led you to specialize in gastroenterology. Please, can you start from those early days?
Yeah, of course. I've finished my medical school in 1999, and then I have to decide for further education and for residency. And at that time, I had opportunity to study in internal medicine, something. So I was trying to choose between cardiology and gastroenterology. At the same time, I was trying to calculate the risk of each profession and the hours you need to work and the duties and all these issues. And I from one side, I love cardiology. At the same time, on the other side, I feel that gastroenterology, it's a huge system actually, starting, from the mouth and ending, I'm always joking in the canalization or in the chute of the system. So I decided to be a gastroenterologist because I like also the endoscopy procedures. So I'm also performing endoscopy, and I feel it's very challenging for me to try not only to put the diagnosis of the patient, at the same time also to treat the patient, because we can perform in endoscopy several treatments like polypectomy, like to stop bleeding in the stomach or in the colon, to take some biopsies, and right now we have a lot of modern technology and technique in endoscopy, so you can also perform the oncology and cancer resection, either in the stomach or, of course, in the colon.
I mean, you were a practicing physician. How did you first became interested in politics, and what motivated your transition from the medicine to public service?
Yeah, I think it. It's the same answer than the first question. Regarding the decision to be a doctor. So decision to be a politic, because also I was born in family, work on the local government. I mean, in the politics and in the municipality election. So I live in a village in Lebanon, in the mountains. Half of the village almost are Abu Meri family surname, and they always been elected the chairman of the council or part of this council, and they were playing a major role in the local policy, in the local politics, in the parliamentary election. So I have seen since I was a child how is my grandfather dealing with politicians, how he's holding a lot of meeting at home, putting a list together, trying to write a program for the city or for the village for the next 4 years. So I have seen this in my childhood, and that's why maybe kept in my mind that that I like to be a politician one day, but I never think that it would be in Latvia or somewhere outside of Lebanon. So it happens that I in 2007, I actually a little bit before in 2002, 3, 4, after the 9/11 terror act in New York and all this Arab phobia and Islamophobia and other things. So I have established in Latvia the Lebanese Society, Cultural Society, and further on the Arabic Culture Center, and all these activities on the non-governmental sector gave me additionally that I'm a doctor. I started to work as a physician. I speak the Latvian language, and I was trying to, from time to time, to give some interviews to the journalists regarding the Middle East region, the conflict in the region, the Arabic Spring, or how was called in that time, revolution, all that in the region. So I was like an expert who was explaining, trying to introduce a lot of information for the Latvian society. So all this together gave me additional popularity, let's say. And then I, of course, I got my citizenship in 2007. And then I had a lot of friends, politicians in that time. And they were preparing for a new party, for a unity party. It's my party right now. 3 different parties together. They unified in a one party, and they decided to work on a program on a let's say a right center ideology, and I like the idea, and I was actually in 2010 or 2009 I started my political career in Latvia.
I mean, it's like nowadays, I mean, you answered already the question which came to my mind while you were talking, but nowadays we all also see that, like in New York, right? The new mayor also is not from New York, and I mean he became very popular, and I think with the same with you. I mean, coming from Lebanon and becoming the Minister of Health in a short period, a relatively short period of time, becoming the Minister of Health of Latvia, I think it's great. And does it help your your experience in another setting, the Middle East setting? Although Lebanon is very well known for its traditional medical education and practice, but does it help you right now to, like, in this context of the Latvian context, which is totally different in my opinion?
Sure, it helps because, it gives me, also I have the Arabic language, it's an additional language in the region here, and then you have a possibility to communicate with the different ministers, Minister of Health or politicians from the Arabic world, as well as, you can use your contact all over the region because, as you mentioned, Lebanese mainly, they have a huge diaspora all over the world, and mainly in the Arabic region, outside Lebanon, in Europe, in America, in the South America. So you have somewhere always some friends or some relatives, and even part of your family. So you always can find a contact in order to help the mission I'm doing right now. And that's why from time to time you can see me, if you follow me on the social media, then I'm meeting Arabic ministers and trying to manage to find a common sense issues where we can work together, cooperate together. For instance, I had the last week visit in Egypt, and I visited the main 3 manufacturing of pharmaceutical manufacturing. And so I'm just trying to maybe to use the Egyptian, production as a effective and cheaper than the European, in order maybe to implement some product in the Latvian market to let the Latvian people have an access to cheaper medicines, and it's very important for them, especially when we are speaking about, for example, hepatitis C, very expensive treatment. When we are speaking about biological agents, they're also very expensive. And so if you can get a cheaper price and effective medicine, so you can help your society and your people. And that's why these kind of communication and connections helps a lot to move forward and to get another, let's say, publications for Republic of Latvia. Outside of EU, because everybody in EU, mainly, in the political society, they know a lot about Latvia and about Baltic states. But outside of EU, usually you have to explain a lot. What does it mean Latvia? Where is located the country? How the population and the main. Is it for tourism? Is it good? Is it a border with Russia and the situation in Ukraine? So all the time you have a lot of explanation about your country. So these connections help a lot to let me just enter quicker and to get the goal I wish to get in our relation with the Middle East region and different Arabic countries.
Do you still see patients?
Yeah, sure. On Friday in the morning, I had 2 hours in the early morning. And on Saturday, I had all the day. I performed like 19 procedure, endoscopy, colonoscopy, and gastroscopy. And then I was communicating with my patient. They were also asking some political questions. It happens from time to time, but they are very happy that they meet the minister and they are able to, you get this feedback from the patients, because as I'm a doctor, at the same time politician, and I'm communicating directly with my patient, so I feel the feedback of any decision I made previously. And this is very important for politician, not to be far away from the people. Because sometimes you sit somewhere, let's say up, we say it up somewhere, on the chair, far from the people, and you take a lot of decision. After 1-2 years, you don't have this touch of feeling how the people every day they live. And this is very important for me that I keep practicing, either for keeping my quality of my profession as a doctor, as well as to feel the feedback from the people of Latvia after any decision I make.
Well, I think for the people of Latvia also, it's like some kind of outstanding. Someone gets a gastritis and say, we shouldn't go to the minister to treat our gastritis, right? Yeah, it's really...
Of course, that I'm getting selfies a lot when I'm working with my patient, because say what gastroenterologist and the minister himself. So I'm very proud to meet you, minister. But at the same time, previously also before I became Minister of Health, I was also MP. I was a member of Parliament, and I'm enough popular in the society. So I also get some selfies from time to time, and people like to come to visit, to have a visit with gastroenterologists, especially famous, because it helps them it gives them a little bit trustful ideas, and let's say they think that the information much more valuable to go to another maybe doctor. Sometimes it happens like that. Yeah.
That's wonderful. In your view, what's the most important trait for a doctor to have?
In my 20 years I have experience as a doctor. I cannot say that I am the most intelligent gastroenterologist in Latvia or in the region, but I have a way of communication. 50% of a medical doctor job is to communicate in a very comprehensive language with his patients, to explain the situation, to get the information in a very normal way, not to push them, not to press them, to let them feel very comfortable during the conversation with you, to trust you. And afterward, when you explain them what they have to do in a very normal language and comprehensive language, they leave the cabinet and they feel that they get a lot of information. They feel better. 50% of the symptom will decrease decline after the visit, mainly. And sometime in 2 weeks, a patient come back and say, listen, I feel free, I'm healthy, thank you very much. So you get this positive reaction in some days, because the patient had a normal communication with you. On Saturday, I had a lady with her husband. They were looking for me for the last 3 years. They visited me in 2021 during the pandemic time with her husband. So they are my patients. And they were looking where they can find me because, I'm not practicing every day. So it's like 2-3 times per month. So they were waiting, and they traveled from Riga, like 60 kilometers, to this city where I was working on Saturday. And they said, I've been to 2 different gastroenterologists. They are good, but I trust you more. I feel that when you will tell me one sentence, what does it mean, this diagnosis, what kind of pills I have to use, I immediately feel healthy, doctor. Thank you very much that you're still practicing. So imagine, she needed this 5 minutes with me, not more. And then I just repeat for her what she has to use from time to time, what pills, the dose, and when we have to meet next time. And it was enough for her. She said, now I feel good. Thank you very much. 3 years, after 3 years, we'll meet again, for instance. Okay? So this is the main way that you have to communicate in a comprehensive language. You have to be polite, even though at the end of the day, and you feel tired, and you have a very tough day, and you have a lot of patients, and maybe yourself you feel also sick maybe sometimes, you should try to have your smile, you should keep the hope for the patient, and you should communicate in the normal and polite and actually kindful way.
Thank you. As a physician, what kind of challenges did you face? I'm sure the challenges are different right now, but like when you were just a physician.
I had a lot of practicing hours, like everybody in Latvia right now. We have a problem with human resources. We have a shortage of workforce, either doctors or nurses or even assistants. So we are trying to compensate. We are trying to work much more hours and even having duties, and especially actually in the pandemic times. So of course, we have sometimes so-called mental burden on your mental health. And that's why the 48% right now the main complaints we receive on the health inspection, on this department concerning of inspection of medical, mistakes and so on, 48% are communication problems. Why? Because the doctor or the nurse, they are tired. They are physically and mentally tired. They are working a lot. They are not sleeping enough hours. They are sometimes, I remember when I had like 25 consultations per day, that I didn't have time to eat myself. Imagine gastroenterologists are not eating regular meals, as well as I'm trying to advise everybody to have the regular meals. So I was trying to do my best to have this lunch, but it doesn't work. Sometimes you keep speaking with one patient more than 20 minutes and 30 minutes, so you have the next patient waiting. And after the next patient, they are, in the corridor, they are waiting and sitting, and so you cannot run somewhere else. So I had, before I became a minister, I was decided in that time that I should decrease the working hours. I should try to get a bit more rest. I remember in the last 15 years, I didn't have a normal holiday, not more than 1 week. Because if I have 2 weeks, I know that I have a lot of patients, especially patients who suffers from ulcerative colitis, Crohn's disease, these serious problems. So you have to keep in contact with them. So you are sitting on the beach, having some rest, and you are receiving messages, and you should answer for the patient what to do, what the dose they have to use at this moment, or where they have to contact, and when they come to you. So all the time you are living in such a stressful moment. You cannot feel free of that. You sometimes you also have very serious cases, and you want to go to sleep. And at the middle of the night, you wake up and you start to think. You take books, you take internet. You are looking for an answer for unclear diagnosis or unclear symptoms. So it was very, stressful job. But comparing to the minister job right now, I believe that job was much more better. There, I felt immediately a positive reaction. Here you are working 24/7, but you don't have just positive feelings. That's why I believe that the stressful job of a physician is much more better to be a minister.
Why you are having this big shortages of medical personnel, and how you are addressing this?
I think that the problem started in 2009-10 when we had this economic crisis, if you remember, in all over the world. And then we, in that time, Latvia started a different reform, a reorganization of the hospital network. A lot of new, let's say, program have started. We didn't have enough fund under the budget. The state budget for the medical sector was completely deficit. It was not like a priority for the policy that time. So that's why we didn't have good salaries, and a lot of medical doctors and nurses in that moment, after we got in the EU, they left. So we almost can estimate like 300,000 Latvian people left the country in the last 10-15 years, and even more maybe. Now we feel a positive signal that some part of them, they are coming back. If they left like 300,000, we are getting back like 30,000, 25,000 in the last 2-3 years. So because of the economic crisis, because of the salaries, in that time, a lot of medical doctors or medical personnel left the country. At the same time, we didn't have enough funds, allocated funds for education. So we didn't support and sponsor a lot of medical school students as well as specialists. So in that time, a lot of specialists, they had to pay themselves, or they had to get a sponsor, a hospital, who are ready to pay for them for the next 5 years. At the same time, they are receiving some salary, and afterward, they go work there, either in the city or in a regional hospital or local hospital. Now we have different situation. We already increased the state allocated finance for the medical sector from the last 10 years, let's say 2.5 times. So if we had it like 800 million 10 years ago, now almost we are in 2 billion euros. At the same time, salaries for medical doctor, instead that they are working a lot of many hours, even more than the acceptable hours they need to work every week. So they are receiving at an average like EU average, if I'm speaking about doctors. We have problem with nurses, and the problem shortage of nurses much more than doctors. And we are trying to give them additional motivation, financial motivation, let's say better hospital environment, better communication, some insurance policy, some, let's say, bonuses, and so on and so on. So we are working on that. I believe that in the last 3 years, all the specialist medical students who wanted to finish their residency, they got support from the government. And we have increased the salary of the resident from 700-800 euros almost to 2,000 euros right now. As well as they are very important for the sector, because without them we will have problem. That's why they are also having their own duties, and they are working in different institutions, and they are earning also more than 2,000 euros. At the end, we also have this EU average. So we need a bit time. I believe that 5-7 years to get again this new resident, new medical students, and also I feel that a lot of our doctors, they are planning to come back. A lot of my friends, why I have to live in England if I'm earning 6,000-7,000 pounds and I can earn it in Latvia, for instance. This is my country. I have my flat there. I'm living with my people, and I have enough experience. I want to come back to my country. So all these positive changes happen in the last 10 years. I believe would improve the situation for the better side. At the same time, I'm not sure that it's going to be solved in the very coming years. So you need 5-7 years. So that's why we are also right now we are going on a reorganization of the hospital networks. We are starting a very serious conversation and dialogue with the sector, with the stakeholders, with the hospital, let's say, directors, and with the owners, with the municipalities, mayors, and so on. And so also we are working on the education system to be elastic. For instance, if you are a specialist and you would like to learn a special manipulation, so you can learn the manipulation parallel to your study in order to gain time. We are changing the credit point. We are trying to speak with the professional association on different bureaucratic procedure improvement of these bureaucratic, let's say, requirements. And regulation. So we have a lot of things it's going on this time, on the last 3-4 years. Of course, the pandemic time played a very major problem for us because let's say, it postponed a lot of reorganizations and decisions needed to make 3-4 years ago.
I mean, you mentioned a lot of positive things, but still I'm going to ask this question to you. Since becoming the Minister of Health, what do you consider your major achievements and what remains most challenging right now?
First of all, when I became Minister of Health, I have decided the first day that I should have a strategy. And I have a so-called Abu Meri plan or strategy plan for the system. And I have drawn it myself on a small tissue paper. I was sitting in the second day after I get minister at home in the middle of the night, and I started to write myself the strategy. Of course, I didn't myself establish the ideas. It's like an international, let's say, strategies in different countries in EU, in Nordic countries, and I immediately just took all things together, and I know the system because I was working, and I'm still working there. So I tried to have this strategy. And main strategy was the short term and the long term. The short term, to decrease the prices of medicine in Latvia, because the wholesalers, it's for me like the brokers, let's say, those companies between the manufacturing and the pharmacies, in that time, they had a percentage benefit on each medicine, on each package. So I decided to change this. And I was fighting them for all the 23, 24. So we were like 1.5 years fighting a very, let's say, cruel fight. I have lost a lot of nerve system. But from the 1st of January this year, the new reform of pricing of medicine have into force. And 70% of medicines in Latvia, the price was decreased almost 15-20%. Some medicine, 50%. For instance, medicine for migraine from 33 euros to 15 and 14 euros. So like half price. And of course, I changed the system and I tried to improve the function of the pharmacist in order to become a person, a part of the treatment team, because we should have like a team from a doctor, nurse, pharmacist, physiotherapist, and so on. And so I put like €1.5 euro for each prescription, 75 cents paid by the government, the state, and 75 paid by the patient himself, in order to let the pharmacist give when he's delivering the medicine, to have a consultation, a conversation with the patient, informing him how to use the medicine, what are the side effects, what are the complications, to use 2 different medicine in one time, and so on and so on. So we started something new in order to keep the pharmacist out of the pharmacy as a sailor, as a person who just delivered the medicine, to a person who learned for 5 years, a high education, and he's happy to offer the patient an additional consultation. This is first for the short term. Long term, digitalization of the system. We have improved the e-health system. We had a lot of technical problems before. We have improved it. We have started a laboratory model from the beginning of this year. So all the laboratory examination result, you can get it for free in the e-health system. We have changed also. We are preparing for so-called e-referral at the same time with e-booking. So you can, and this is will help, especially for those patients who are waiting, decreasing the waiting time for 15-20%. We are planning to start from next year. From 20th of November, we started with e-referral from 1 week ago, even less than 1 week. So digitalization, it was very important for me, and we have established the Health Digital Center. And this is my decision and the government decision. We have also started the methodological centers. So we have like 11 centers in order to have our guidelines, in order to follow the quality of the services in rehabilitation, oncology, especially oncology, because we are facing a lot of problem in oncology, in screening, in prevention, in treatment. So we have this methodological center in order to get all the guidelines, the indication, the adequate treatment. So the economic issue of these centers, in order to calculate the expenses for each sector, for each service, let's say. So we also have started this one, and of course a lot of changes in education system, residency, hospitals, let's say the ideas to switch from 5 levels of different hospitals to 3 levels. We are following the Finnish examples, the Danish one. We are working very hardly also with the Baltic states, and especially with Lithuania and Estonia on the critical medicine reserve. So we are working together in order to make our reserve in case of so-called X hour, because of the situation in Ukraine and the aggression of Russia. So we are preparing our also civil defense issues, the hospitals. We also started to work on different education program for our medical student. So they have so-called military medicine courses, and we started this year the advanced nurse program. We adopted from Hopkins hospitals from Baltimore. So in these 2 years, a lot of things have started. We also started in the Clinical University Hospital, so-called hospital at home. And this is very, very well known in Saudi Arabia and in Lebanon, also in the United States, especially for those patients who have chronic diseases like lung problems, cardiology problems, in order to keep them at home and not to be admitted to the hospital from time to time, So we have this digital monitoring from the hospital. And of course, we have reorganized and we push the primary health system to be much more active, to follow up the screening and the prevention for oncology patients, and not only, of course, for cardiology patients. So we work with the family doctors a lot. We have increased their funds, by the way. We already, in the new budget, state budget, we are trying to give a motivation payment for those family doctors who will to work outside of cities, in the countrysides, in the rural regions. So we are working on different levels, because you cannot move forward only working on one specific level. So you have to move parallel and work all the time.
Since you touched also oncology, and we were coming to that, what's the current situation with cancer in Latvia?
It's getting better. If I compare, we had a pilot project for 23-24, and we see, since we are pushing on the screening of breast cancer, for instance, and since we increased the allocated fund for the reimbursement medicine concerning oncology mainly, breast cancer, new innovative medicines, let's say, So we have like 27% improving in the figures, 27% increasing in the 5-year survival rates, even though we have a better result for those patients who had the stage 4 oncology cancer. Okay, so we are moving forward. Of course, we are working on a different program right now. I believe that the Center for Disease Prevention and Control, they're doing a great job concerning raising awareness, campaigns, education, continuous education for our specialist family doctors, much more allocated European funds we are just putting in the system to improve the participation of Latvian people receiving invitation to go for screening of breast cancer, mammography, for instance. We have already established well-equipped digital mammography bus moving all around the countryside for those patients and ladies who are not able to travel very often to the hospital or to let's say to the clinic to get the mammography. We also have increased the funds for HPV vaccine till 24 years old, covered by the state, either for boys or for girls, in order to increase the risk of cervical cancer. We also working very hardly to increase the percentage of people will to participate in screening. For instance, now we have like more than 50% on cervical cancer, as well as we have like almost 38%, 40% on breast cancer. Of course, the EU average is 70%. But if I compare it to 3-4 years ago, we had like 20% and 15%. Colorectal cancer. So as a gastroenterologist, I feel that it's my duty to speak about colorectal cancer much more than others, And then I feel that we had it like 15% 3 years ago. Right now, it's like 27, 28%. Why? Because we are speaking about this all the time. We are trying to let also other specialists, not only gastroenterologists and internists, family doctors, not only oncologists, all specialists, just to remind their patient, after age of 45, as a man, you have to go and get to give these blood samples for PSA, for prostate cancer. As a woman, the woman is receiving a invitation letter from the National Health Services. We understood that this letter sometimes is not getting the right address, or the patient change his the physical address where he's living right now. Maybe he has 2 apartments. He lives in one, and he received another apartment in the letter, and some other people are living there. So we introduced 2 years ago so-called e-address. So those ladies who have e-address, a digital one, they also is receiving to this e-address the invitation letter for cervical cancer screening and for breast cancer screening. So we are actually working also on so-called screening registry in order to get enough data. Because from time to time, if I compare the Latvian data, incidence of oncology and treatment and mortality rate in Latvia to EU, we always see that Latvia in the lowest places. At the end of the list, But we feel that it's not the real data. I think that we don't have enough data to be analyzed. That's why I believe in the next 2 years, when this register will be the platform for screening will be done, and all the information of our patient will be inside, digitalized. So we will have much more better figures, either on mortality rate or on screening. So we have a lot of things yet to do. Of course, we have a lot of recommendations from EU, from different international experts, from WHO, and we are trying to implement them, in a regular basis. But of course, it would take time for us. At the same time, the much more challenge for us is the mentality of people, the way of thinking. So we are working on that because people, for men, for instance, they think that they don't have to go to doctor if they don't have any complaints, if they are not suffering a pain. I remember as a gastroenterologist, mainly men who came to the visit because of their wives. So his wife told him that you have a bad smell, or you get fat, or maybe you have a diarrhea or constipation. So she called for the visit, and she booked the visit with the doctor, and either she come with the patient, with her husband, or she send him. So this is a problem for us, that men, mainly, they are not going very often. And that's why we feel that the incidence of oncology in men in Latvia is much more than in women. Yeah, because they are not going for checkup. They don't think that they have to get their screening. Yeah, and of course we have started, as I mentioned, the prostate screening cancer 2 years ago. It's still not it's not very popular, but we are reminding. So we have in November. It was like this. Months for men. I was trying also to remind men in Latvia that they have to think about themselves, not only to get this PSA, but also to think about their mental health. It is very important. So we are working in a lot of things together, and I believe that improvement are going. For instance, also we had a lot of in the last 2 years we have increased the oncology treatment. I mean, the fund, the allocated finance for oncology treatment, for oncological medicines, from 50 million till 80 million, almost. In general, we have increased the reimbursement allocated fund for reimbursement list of medicine from 220 million to 320 million, 100 million in 2 years.
Excellent.
Of course, all these improvements will give a result. And the result, if you ask me today, I cannot immediately give you the figures, but I'm sure that in 2 years, we will have, it would be a very important impact on these figures, either on mortality rate or on the incidence of oncology patients.
For sure. I mean, when you get the data, it's gonna, compound, and in few years you will see the great results coming. What about the smoking?
Yeah, this is very interesting. When I was MP in 2023, we were working on the tobacco and nicotine product law to ban different type of e-cigarettes which contain flavors. And the law was, the amendment and the law adopted in 2024, and from the beginning of the 1st of January, already into force. So the main task to decrease the, especially for students, for youth, because we see that we in the last 5 years, especially from the pandemic time, COVID pandemic, we have increased the percentage of young people using or have tried. Let's say cigarettes at least once, or using this vape with flavor, have increased very quickly. If previously we had like 30%, we had like now 39%. And almost 50% of the pupils and the student, they already tried once cigarette, or they are right now using type of vape with different flavors. So that's why the aim of this law amendment was to decrease and to ban the vape with flavors. And from the beginning of this year, even not from the beginning of this, I think from last year, August, 2024 August, the law was into force, and you cannot buy in Latvia anymore a vape with flavor.
Excellent.
Of course, the let's say the industry, they are very innovative, and they try to do something else. So they just also create now a small bottles, plastic bottles with some drops of flavors, food substances, something like that. And they try, because they are very innovative, they try to put it on the vapes with a tobacco, a normal tobacco flavor. So we are also again facing a next step of challenges, because the young people, they still try to use it. But Advertisement is also prohibited. We also increased the age of purchasing and of also using tobacco. So previously it was 18 years. Now it's only starting the legal age 20 years. So advertisement, the age, band of selling such e-cigarettes. Also, we worked on the nicotine patches. So previously we didn't have the maximum, let's say, amount of nicotine. So right now the maximum is like 4 milligram, the maximum nicotine amount. So previously it was maybe 8, sometimes more. So we tried also to put the maximum because we know that nicotine, the problem is first from cigarette is nicotine, and of course this burning process, which make also cancer, lung cancer, stomach cancer, and so on. So the nearest, let's say, outcome of this amendment and of these changes and these regulations, I believe that we will get it on next year. I mean, on 26 autumn, because we need like a time. But of course, we're still facing other challenges. We live in EU and in an open market, no borders. Cross-border, movement from all sides, in EU, it's all the time on place. So Lithuania, Estonia, they have similar regulations. And they also prohibit flavors. They also changing advertisement law and so on and so on. But I believe that Denmark also working on this, Netherlands, but we still are facing that in general EU, these products are available on the access on internet. And even though when you travel outside of the border to Germany, somewhere else, to Poland, so you are able on the airport to buy how much you want, all these vapes with different flavors. So, or also you get so-called unlegal chains, supply chains. They are also selling for our children these unlegal issues. So these are the much more challenges what we are facing right now. And that's why in every meeting in EU level with my colleagues from EU, different health ministers, I'm reminding that we should have a unified regulation. The directive of tobacco and nicotine, EU directive, we need to change something. And we cannot take it like a national issue. It's a European issue. And if I take a regulation and this regulation, I cannot implement it 100%, so these regulations are not going to work very well. So the next step and the most important thing to do is to get a unified regulation all over the EU in order to ban different flavors, different e-cigarette types, and in order to decrease the consumption of tobaccos and nicotine all over EU countries and our people. So we live in one region and in one space.
Since you touched also EU, I would like to take you on your vision for the healthcare in the EU. I mean, especially cancer care in terms of cooperation, standards, innovation, equity, all these kind of things. I mean, what's your vision? I mean, you touched already on one of the aspects, certainly, about this change of tobacco into the country, but like in general.
We didn't mention alcohol also, consumption of alcohol. Also, Latvia, I believe now in EU, like it's the third or the fourth country on the highest place, of consumption, like 11.7 liter per person. Okay, so alcohol is one of the most challenging problem, and also we have adopted a law for restriction of advertisement. We decreased the time of selling and purchasing time, especially in the holidays, in order to get the patient working on Mondays. So we have also changed a lot of things on this matter, and this law also started. It's actually into force from the beginning of January this year. But at the same time, we also have the same problem. So we put also excise on tobaccos, by the way, and the state budget also we put additional excise taxes on the tobacco and on the alcohol as well. Okay, but we still also facing that the different countries, they don't have such a law, and this cooperation between the EU countries is very important. So concerning oncology, so if you think about oncology, what are the main reasons for oncology in general? Okay, one part of it, genetics. Smoking, right?
Yes.
Lung cancer, stomach cancer, blood cancer, yeah. The second reason also alcohol, using a lot of alcohol. Pancreatic cancer, colon cancer, liver cancer, gynecology, and so on and so on. The third reason is
Environmental.
low physical activities, obesity. Also, is a big problem in Latvia. We have some weeks ago we have passed a decision and we adopted a new plan to combat obesity, as well as oncology plan. It passed in the cabinet of ministers some weeks ago. These are also job what I'm trying to finish till the end of this year. Different plan, you know. And these also a common problem: obesity, alcohol, smoking. Reason for oncology and for cardiovascular diseases. So if you are speaking of cooperation on the EU level, so first of all, we have to have a one unified policy for all over EU countries on different issues and different problems. And every time you are speaking about infectious diseases, non-communicable diseases, as a very important, combating obesity, how to fight against addiction, for instance. Yeah, this is also a problem for using of different narcotics and so on. So we have a lot of things together. We are living in one region, one space, as a one whole country. So we should be united, first of all, in different sectors, and one of them is health sector.
Who have been your mentors?
I think that I'm a person trying to continuously learn from somebody. I'm not trying to ask questions. I'm not trying to call somebody, even, let's say, ex-president of Latvia. I'm sometimes calling ex-president of Latvia, visiting them, and this, for example, President Freiberga, Vairavik Freiberga, it's one of the politician have done a lot for Latvia. And she's a lady with a brilliant mind, and sitting with her some hours, you learn a lot. In politics, first of all, how things are going, and also in culture, because she's a person with a wide spectrum and experience of different cultures. European culture, Canadian culture, Latvian culture, so you learn from such persons. Of course, I'm also trying to meet different friends, professors from different, by the way, sectors. Economy, health, politician, journalist, and they are older, maybe in 10, 15, 20 years, and even younger. So I'm trying also from time to time to have a dinner, to lunch, to discuss the actual problems or subject right now in politics in the country, in Europe, all over the world. And we have different visions, ideas, views, and try to learn from them. And of course, you try all the time, you have to look around you for those people who are helping you, because they could be also your mentors. And I'm very happy that I have a great team. I mean, my team in the ministry. So yeah, as I mentioned, I'm trying also to also learn from my team, because my team, they are different people in different positions, different specialties, and so advisor for communication, advisor for legal issues, advisor for and so on and so on. And so you all the time learn from them, because you have to work with them, and they have to tell you what to do in a very certain for certain problem to solve it, or also to an idea to realize in future. So these are the people what I'm all the time communicating around, and I have a long list of names actually.
What advice would you have for the younger generation?
I think two main advices. First of all, health is not an issue just we born like that and that's all. And we should live and we should try everything around. Health, your health is everything for you. So it's a responsibility what you have to take care of all the time. So you have to take care of your sleep, you have to take care of your physical activities, of your food, of your nervous system. And so that's why for those young people and children, you have to care about your health from the very beginning. This is the first advice. The second advice is that everything is possible. So any dream, you have it in your childhood. Any aim, you want to reach it. It's possible, but you have to be patient. You have to work for that. You have not to be angry if you fail sometimes. You have to stand up again and try again and retry. And I'm sure you will get to your dream and you will reach your goal. So these are the main things what I would like to.
Wonderful advices. Are there books you would recommend? I mean, which books you would recommend to anyone to read?
Oh yeah, in the last 2 years I haven't read any book, by the way. I don't have time to read any book, but I'm trying. But I have a.
What's your favorite one?
Yeah, the last one I've read some years ago. It's a huge book, book of Al Gore, Vice President Al Gore.
Yeah. Yes,
you remember
of course.
Al Gore was President Obama. So he had a book about the climate changes, about the economy, about the policy. And these were the last thing I've read because it was huge and I read it in different, period. It's showing the way of thinking of a politician, and it's showing us actually the serious challenges we are going to face in the future. Because climate changes is not just a business. Sometimes some people using populism are using that climate change as simple business just to have an electric cars and so on. But climate change is a real challenge for us. It will be in 100 years a problem for a small islands. And right now we are facing such problems. And this book was just gave me just an impulse to think what's going to be in the next 100 years in this world, the challenges, and am I ready to participate to change something in order to save the world in the future? To this book, but I'm also getting these small books. Sometimes I forget the name of this writer. They are like small. They are selling usually in different bookshop in the airports, and they are small handbooks, and they are just having some different chapters about different experience in life. And these sometimes I'm trying to read, but I don't remember this.
So you are also at the airport. You try to catch some books and read on the phone.
Yeah, they are small, and then you can read it in one day, and sometimes in the plane. And they are chapter about different ideas about everyday life, how to get away from stress, how to get friends, how to lose friends, how these things. Not philosophy. Yeah.
If you describe yourself in one sentence, who is Dr. Hosams Abu Meri?
I think I'm a person who devoted himself for the benefit of people I live with. So I live in Latvia, so I have to care about my people. As a doctor, as a politician, as a person, in spite that I'm receiving per day a lot of, letters, some insulting, let's say, letters and sentences from different people every day. But it makes me feel better that I'm doing something, I'm changing something, I'm working on something. That's why somebody's in somewhere.
And the final question, which I ask usually to my guests, who I should interview next?
I have, maybe it's for me, it's very personal person. I mean, I like, we had an ex-prime minister, his name is Ivars Godmanis. He was in the beginning of the 90s, 93, 92, 91. He was the prime minister in that time when Latvia regained the independence. And afterward, he was also minister for some times, and then prime minister in 2009, 8. But he's a professor of economy, and he's a great politician, and you know, to talk with him, it's a pleasure, because you'll get a lot of information, you learn something new always, and he's still actually teaching right now. He is lecturing, have some lecture in some universities, and he was also a member of European Parliament as well.
With great
So
pleasure.
this person for me, as a mentor, as you mentioned, from time to time, I like, for instance, 1 month ago, he called me. He said, "You had an interview. I don't like this. You should say like that. I advise you to do this." No, something like that. So this person is
With great
is
pleasure.
very
I'd just
lovely.
like to, I'll ask for your introduction, and with great pleasure, I'll interview him.
Yeah. Sure.
Thank you so much. Thank you
Yeah.
very much.
Thank you very
It was a
much.
great pleasure, really.
Thank you.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.